Now, what causes chronic fatigue syndrome?
Well, again, this is something that the definition or the cause is unknown at this time. However, there are diseases that we associate or might be related to the disease, and I'll just go through them. Studies have found that people who have the chronic fatigue syndrome have what they found is high titers of Epstein-Barr virus or cyclomegaly, even Lyme disease, and these they feel that are directly related or could be causing the chronic fatigue syndrome.
Okay, we're going to like you to make the calls. The telephone number is up on the screen, and we're going to pause here to give you a chance to call in, and then we're going to go further and talk to Dr. Tamio about what you could be having these symptoms, and you could go into the hospital and they can find that nothing's wrong with you. We're going to ask Dr. Tamio about that, and how do you deal with that, and how should you be able to communicate with your physician if you have these kind of symptoms. The telephone number's on the screen. We look forward to your calls, and I know there's really some things here that you would like answered, and we don't want to wait until the program is almost off and then we get a whole bunch of calls. We want you to call right now. Okay, Dr. Tamio, the person who is may go into the doctor's office, and they can complain, you know, about not only just one of these, but they complain about many of them. I got the pain, you know, I got the depression, I got the fatigue, and the doctor could say, you know, there's nothing wrong. Is that possible?
Yeah, it's possible. It also depends on your training and your background, your knowledge, and your acceptance of this particular syndrome, that it does exist. If a patient comes in with these complaints, again, and I emphasize in every show the importance of a history and physical, very important. And what I do is I take a good history, and we go through a physical, and I do my routine blood work. And if a patient comes in with these particular complaints, what I usually do is I draw baseline titers. I would do an Epstein-Barr virus titer. I do a cyclomegaly virus titer. I would also do a Lyme titer. And I would also do, which is standard for me, I do a thyroid profile to see if there's any changes there, because I want to make sure that there's no metabolic disorders, as well as my routine CBC, which is a complete blood count, and SMA7, which would be electrolytes to make sure everything is within normal or in balance. So very important there. Once I find and I get the results back, and I go through and I do a physical exam where I check the musculoskeletal, and we look at the trigger points, and then I look at the tendon points to see if there's a difference, and then we take it from there.
Okay, we have a caller. Go right ahead. Go right ahead. We'll take your call. Okay, Dr. Tamio, while we're waiting for that call to go through, and as soon as it's through, you can go right ahead and ask your question. Many of these that we mentioned are almost flu-like, you know, and is it possible that a person can be getting treatment for flu when it's chronic fatigue syndrome?
Yes. Again, that's a good point that you mentioned, flu-like. The two titers that I mentioned, the Epstein-Barr virus, again, here virus or cyclomegaly virus, that would be similar. The side effects or what we call signs symptoms could be to the flu. So again, what I like to do is I do a baseline titer, and I see what their levels are. From there, I make a decision. Again, I sit down with the patient, and we come up and make a decision on how we're going to treat this.
Okay, you're on the line. Go right ahead. Okay, we're still having some technical problems, Dr. Tamio. Then you're suggesting then that if a person goes into their physician with symptoms like that, they should ask for a full examination, am I right?
That's correct.
Instead of being treated immediately for a flu or you know, the normal shot or to take, you know, some penicillin or something like that. What should they ask the doctor to do?
Well, again, when you go, like I always said, you must have a good relationship with your physician. You must feel comfortable with them. You must be able to sit down and have a conversation, an educational conversation, and be able to discuss your symptoms and feel comfortable with it. Once you do that, you really should have a complete history and physical. Again, that would be the conversation aspect. And the physical itself, you want the physician to really do a thorough workup and educate you on what he or she, your physician, is doing during the process. From there, you want to do a complete workup regarding the labs and include all those labs that I mentioned, the Epstein-Barr virus, a Lyme titer, a cyclomegaly virus titer, very important, as well as your routine lab work.
Right. We're going to come back with some, with some practical situation on this. But folks, we're having some technical problems. Don't be discouraged. We're going to have the phones cleared up in a few minutes and some bugs in there. But we want you to continue to call. Your questions are very important, not only to us, but to many of those who are listening. And so we're going to ask you to just bear with us as we try to clear up the phone line so that you'll be able to ask your questions, okay? Chronic fatigue syndrome, does it have what they call periods of times where it'll come on and then disappear and then come back again? Is that symptomatic?
I believe it is. I believe you can have periods of time where you're feeling good about yourself and everything's going fine. And then you can have recurrent episodes where you just feel lousy, and then you go to the doctor and you come in an example was you went into the physician and your test came back negative, normal, everything normal, but you still feel lousy.
Right.
This is something that you really need to do a thorough workup, and you also need to, again, listen to the history of what the patient's telling you. Just because of the labs, everything comes back negative, normal. Again, there is a psychological, a mental health component that's involved. We don't know. You must ask about the living arrangements, because someone would have what we call cabin fever, where they stay indoors all the day, all the time, and you lead to depression. So what I suggest to my patients...
Okay, we got a caller. Go right ahead. You're on the line.
Hello?
Yes, go right ahead.
Yes. I have a question for the doctor. I had a little lump between my ear and my throat here, and sometimes I have a pain down in my shoulder.
Okay, the question was that she had a lump between her shoulder, within her neck between her shoulder. Again, something like that, that's just too broad to define. The only suggestion is I would offer you to go into your physician and get a thorough workup to find out what that is, because that could be any number of things. Something very benign to something malignant, meaning something very simple to something very complex. So you need to go in and have a thorough workup just to make sure and be on the safe side.
I told him, and he said that is just, if it gets any bigger, he will see, because it's there for 2 years. But now it have a little pain there.
Okay. So you saw your physician, and...
I saw my physician, and I told him about it, and he examined it, and he told me that it's there for 2 years. But now, for the past week and a half, it's continued paining me.
Okay. Right. All right. So we've been, the physician's been watching this for 2 years, but now it seems the symptoms are progressing. What I suggest is you go back, if you're not happy with the results...
Change the doctor.
Yes, I go for a second opinion.
Or see Dr. Tommy.
Yeah, or you can come in and see me, and I'll take a look at it, and we'll see what we have to do.
So where is your office is?
Okay, right at the end of the program, we're going to have the telephone numbers on the screen, and we want you to take the numbers down. By the way, all of those callers who are calling in and you need to talk to Dr. Tomio, the telephone number is on the screen. You can call him. Dr. Tomio will be here even after the broadcast, and you want to still call in and ask a question, you can do that. Now, we don't need your name, whatever, so call in. Thank you very much. Watch the end of the program, ma'am, and we'll have that all for you.
Thank you very much, sir.
God bless you.
Thank you for calling in.